All right, good evening, everybody, and thank you for coming out on a wet, dark night. So we have a full agenda. So did anybody have a chance to look at the November meeting minutes?
I did, and I have two questions. One question is it states that the function is performed by the state. This has to do with the mosquito spraying. Is that correct? That it's not the township that does it or the county, but the state?
The county. John, I thought it was the county.
Well, the county does it as an agent of the state.
Right.
Okay, I just need, and then second, under new business, Joan discussed proposed student projects. I think it's supposed to be Jane, me.
Oh,
Thank you.
Thank you very much. If you could give those to Marie, that'd be great, the corrections. Thank you so much. All right. So before we proceed, I wanted to acknowledge Commissioner Nagel being his last meeting here with the Board of Health, and wanted to say how much we've enjoyed working with John over the past couple years. Always been a strong advocate for the Board of Health. It's really been a true pleasure to work with you, John. You've done a lot in terms of supporting us, your knowledge, your breadth of information, and just knowing the history of things and guiding us in the right direction has been so appreciated by the Board of Health. And we want to thank you.
Thank you very much.
And just a little highlight, John was head of, on the Parks and Rec Board for 13 years, correct? A Board of Commissioner in our 5th Ward in Radnor Township for the past 10 years. So
I also did 3 years on EAC.
okay, as well. Well, thank you so very much, and we're really going to miss you a lot.
Well, I'm certainly not leaving town.
We know where you live. Well, thank you so much for your public service. It's really been great. Did we want to take a photograph with the board? I thought if you're in agreement.
It's up to you.
Okay, that'd be nice. Yes.
I'll be busy with those folks.
Doing what? Next to the big man.
Just this way, just a little bit, just so I can stand
No
here.
podium mic. Wait, we're not on here yet.
Okay. One, two. Okay, one more. One, two. Perfect. Thank you.
All right, moving on to some other business. Marie, would you like to give the health officers a report, please?
Sure, thank you, Linda. This past month, we did 12 food facility inspections. I had the indoor pool inspections moved to quarterly now instead of monthly. However, we'll still do the outdoor pools during their seasons. They'll remain on a monthly inspection schedule. There's only 1 animal bite this past month and 2 public health complaints. I also met with Radnor PD and 2 representatives from COSA in the last few weeks. We're still trying to figure out kind of who to call in certain situations when it involves the elderly and whether it's a hoarding situation or just poor living conditions. So we got some good information when we met with them. We met with the director of COSA and the director of the Protective Services unit. The plan is to meet again with our codes department, law enforcement, representatives from COSA, and sometime in the spring, and kind of all meet together so we can all coordinate and go over the details of kind of how to play those situations out. So that was a plus. Just to let you know, if you guys hadn't heard, over the weekend, Saturday, The Parks Department hosted Santa's Delivery. That was an all-day event from about 3 o'clock till about 8:30. Tammy and her staff do an amazing job putting this event together. It's a huge event. It has grown so much. There were over 1,000 presents delivered. There were 550-some stops. There were several fire companies involved. There were 5 different zones. And there were over 50 staff volunteers. So it was a great event. I participated in it. Katie participated in it. And, we had a lot of fun, and it was a whole lot of positive feedback. And then finally, I just want to take a second as well to thank you, Mr. Nagel. You have been an incredible resource to me from when I first started, entering into this position, and I'm so grateful for that. I admire your commitment to public service, and I so appreciate your pleasantness and your approachable personality and disposition. It really meant the world to me, and I appreciate it.
Thank you.
Thank you.
Thank you, Marie, for a good report. All right, so let's, on to old business, vaping in public spaces. So we had some emails floating around in the past month, and I know Radnor enforces a Clean Indoor Act. And I looked back in our past meetings, and back in October of 2018, Dr. Wheeler at that time reported on PA smoking regulations. There are already laws in Pennsylvania at that time that limit what our board can recommend. So we put out a position statement, and it reads as follows. The Radnor Township Board of Health, after much discussion on literature and Pennsylvania law regarding smoking in indoor public athletic and recreational areas, recommends that each township park or playground in a smoking area be established. The area must be clearly marked to comply with state law. So this is something the Board of Health had worked on over a year ago. And I didn't know if anybody had anything else to add. Commissioner Megel, I know you reached out to our solicitor.
Yeah, I haven't got any feedback from him yet. I anticipate that we certainly will be able to apply it to public areas. And this was the question about can we outlaw vaping, essentially. But I don't know that we're going to be able to prohibit the sale. I think commerce will trump us on that.
Agree with you. Dr. Haymaker couldn't be here tonight, but she had done a little bit of research into some of the laws, and I queried some of the information online, and really there's no smoke-free restrictions in e-cigarette use in Pennsylvania as of yet, but I know Philadelphia passed something which in 2020, what they're going to do is minors will not be able to go into establishments that sell e-cigarettes starting this July of 2020. So e-liquids, that sort of thing. So I was kind of surprised to see that. So, and really 2 states, Rhode Island and Washington, temporarily had the emergency ban on flavored e-cigarettes among the adult population, so no sales at all in those 2 states. And Massachusetts has been pretty progressive, as well as New York City. Their legislation right now on permanent banning of flavored vaping products, so I guess more to come. Statistically, 2,400 patients have been hospitalized for lung-related, vaping-related injuries as of last week in all 50 states. 52 deaths have been confirmed, and most of it's linked to vitamin E acetate at the site of lung injury. So vaping THC with vitamin E seems to be the cause of a lot of the illnesses and deaths. So I guess more to come. So maybe we should look at this next month when we get a little more information. But if we're banning smoking in public areas, I think that should totally apply to vaping in public areas as well. Seems to make sense.
So if I may, because it seems to me there are 3 issues, 2 which are outside of our reach, and one of which I think we can make. I don't know that we need to move it any further than where we are to make a recommendation. So commerce will trump us on sale. And the state has its own approach, or the cities have their own approach to allowing people into the access to buying them, use But I don't see anything that would preclude us from, as a Board of Health, recommending that the township add vaping to any preclusion currently available for smoking in public spaces. So really nothing more than saying, anywhere that the township precludes smoking in public spaces, we should also preclude vaping. And that doesn't mean that we need to finish the job there, but we could certainly do that now, I think, just a recommendation to the board.
I have two questions. When you said minors have to stay out of establishments that sell it, but CVS, Rite Aid, all those places sell it, so that I'm confused on that. And Department of Commerce, do you mean the Pennsylvania Department of Commerce?
What I was speaking of was the rules that affect commerce intrastate. My guess is trump the ability of us.
I don't think, because we can exceed those. We can exceed state and interstate rules. Our township can exceed them. We can't be more lenient than them. We can exceed them. And also, health comes before commerce.
Well, again, we'll have to wait and see what John comes back with, but my experience has been this is the kind of area where the state is preeminent and you can't exceed or go with a lesser standard. So we'll wait for the official ruling back from the solicitor.
So what's the process? Are we going to
I've already requested.
Oh, okay.
Yeah.
All right.
And for the other matter that you're mentioning, you could recommend a definitional change in our code such that where it currently says tobacco or tobacco products, that you just broaden that to include vaping.
Yeah, so when I said underage, that is in the city of Philadelphia. So that would not apply out here. So that's what Philadelphia is doing. Okay, so I think it would be reasonable to do that. So would we take that to the Board of Commissioners or add that? Okay. All right,
We're
so.
going to make a recommendation on definitional change
Mhm.
to already proposed, already enacted, correct? Right.
Okay, we can follow up offline, so Marie and I will talk offline and then see when we can get on the agenda for the Board of Commissioners next meeting on that. All right, anything else to add with that? Okay. Okay, did you want to talk about the interns project, Jen? Or,
I will defer to the interns.
sorry,
That's okay.
sorry.
So as of right now, we have our survey questions drafted. We still need to send them out after Dr. Kabasi and reviews them. And as well as I talked to my friend who works at the school paper, and she said we are able to print articles, and we still need to meet with administrators or guidance counselors about gaining research and opinions from them.
And we're planning to send them out probably after winter break in January. And once we meet with the guidance counselors, we'll be able to send those questions out.
I do have a question, though, about gaining permission to do the survey. Do you have some sort of way to go about that mechanism at the school that will grant you permission to distribute the survey?
That's what we're going to be discussing when we meet with either the administrators or the guidance counselor. Is going to be talking about which way would be best to distribute our survey.
It's not just the way to distribute, it's getting actual permission to do the survey, to complete the survey, because you can't just hand it out. If it's going through your school, there has to be some sort of mechanism for that, for gaining permission. When you talk to the council, they'll know. Okay. All right.
So with the school newspaper, if we do decide to send it out through there, Ms. Kegvis the principal, she has to approve it first. So if she doesn't approve it, then we can talk to her and figure something out.
Okay, thank you, and thank you, Jane, for taking the lead on guiding the students, and thank you so much for the update. So maybe next month we can help you and I'm sure give another update. That'd be awesome. All right, so under new business, we have the Delaware County Health Study. We have guest speakers here, Rosemary Halt, Roberta Winters, and Kathy Wright from Bryn Mawr Hospital. So would you mind doing your presentation? Great.
I'm Roberta Winters, and I'm president of the League of Women Voters of Radnor Township, and I'm pleased to have worked with Rosemary Holt over several years as we've tried to encourage the inclusion of a Department of Health in Delaware County. And so I'm not going to say anything more because she is the expert. Thank you.
Thanks. And I did get my slides, and they're up here, but I don't see them on your screen. Do I have to do something else? Oh, they're there. Thank you. Okay, and I also gave some handouts that are available. I have the slides on a handout for you. So just as Roberta said, we have been working on this issue of public health in Delaware County as the League since 2007 is when we started our study. And I'll talk a little bit about the history really quickly when I go through the slides. But this is some basic stuff. You guys are the Public Health Committee here, so you don't really need to know all this, but that's our basic thing that we share with people. These. Mm-hmm.
This is televised, so you may want to.
Oh, great. Okay.
That'd be great if you don't mind.
Yeah. So this is just a really the standard what is public health, because a lot of people confuse public health and individual health. And really what public health does is the essential job is to monitor, target, and identify issues and enforce laws. So, and then there's a whole bunch of other things that, the big picture is that provides assurance, assessment, and policy development. So, this is a really good lens to look at all the things as, the issues are coming up in Delaware County. I look at this as my checkbox, like, are these things happening or not happening, and how is it impacting our community? So, and this is just the basic laws around public health to form a county health department in Pennsylvania. The biggest one is Act 315, and that would give the authority of the county then to enact all of the responsibilities and administration, which currently lies with the Pennsylvania Department of Health. So Delaware County doesn't have a health department. The legal entity is the Pennsylvania Department of Health. And so by forming this, we would be enabling other laws and codes to be enacted in under Pennsylvania statute to apply to our county health department. So there is only 6 county health departments currently in Pennsylvania, so that's out of 67 counties. So, but these are the most populous counties, and Delaware County is the largest county in Pennsylvania and in the United States by population that does not have a county health department. So there's some municipal health departments, and over the years since we started doing this, there has been a movement, particularly in the Allentown and Bethlehem areas, to do a joint county health department. Unfortunately, that failed by 1 vote on the commissioners for enactment after several years initiative. So there hasn't been a new county health department formed in Pennsylvania since Montgomery County. And just to give you a brief, and this is slightly different than your handouts because this is a living document and we've been updating it as more information has been coming in through which I'll talk about the current county council's issues with the health department. But basically the history, 1968, there was the Citizens for Better Public Health. It was a large group that started this initiative in Delaware County. It failed in a public referendum, but Scott Paper, all the major hospitals, all the insurance companies, they had a fund for this to form the health department. It was very, very close to happening. but unfortunately it did not. And then there was actually another, in 1992, this was something I recently found out, there was actually another initiative to have a health department, which also failed. In 2007, we had the League of Women Voters started our consensus. And 2010, through that consensus study and information that we provided, the county got Johns Hopkins to do a report. But that was not a feasibility study. That was just basically a county health assessment and what are the things that the county needed. So basically, our findings initially in 2009 was that the county had a fragmented county public health system, loss of federal and state funds because of not having a county health department, and limited public health data and epidemiology. And so those things we have found still exist in the county. But we wanted to update some other things, so we conducted additional interviews, analyzed current public health data. We reviewed the previous studies and reached out to policymakers for follow-up. These are the counties that we interviewed. We interviewed the county health director from each of the counties. In Delaware County, we interviewed the director of intercommunity health and the Pennsylvania Department of Health nurse who was in charge of the county health services in Delaware County, representing the Pennsylvania Department of Health. Basically, we're finding the same things: lack the interconnectedness, limited funding streams, and limited epidemiology. It was really interesting in talking with the county health department directors. Many of them were very, very excited that Delaware County was even considering getting a health department because they thought that it would really enhance the regional approach to public health, and that they felt like they were really, sometimes truthfully covering Delaware County because there was not a really county health department. And so oftentimes if a case such as rabies or TB that they couldn't handle in our county would sometimes be taken up by the other counties. And then the other thing that was coming out, like in particularly where Delaware County borders these counties, there was particularly, for example, with Philadelphia and Delaware County in 69th Street area, there is, oftentimes, particularly around the opioid epidemic or some outbreaks, that Philadelphia feels kind of restricted by that barrier, and their cases are going back and forth. Once it goes over to the county line, they're kind of stuck. And so it's this very difficult process just in the southeast region without, they call Delaware County the donut hole of public health in the southeast. So, just that, and I think that is really telling when other public health people are looking at Delaware County in that way. Just really, this is the most common question that people asked us. And we did not include a financial review. That's kind of out of our scope. If we did a feasibility study in Delaware County, this would be certainly one thing that would be included. But this is a basic analysis based on some national and other data that we had from the 2006 and 7 review. And most of this hasn't really changed that much. So, you would most likely, a large part of the funding comes from the state government under Act 315. They match about 50% of the funding. And the national would be about 36%. And then, we'd be looking at some other sources just from inspections, grants, those types of things that would be able to come into the county. And this is just basically a reminder that post 9/11 and post Katrina, it's a little late to form these things when we're looking at, a crisis. These are some of the action steps that the League is recommending. So we're recommending that Johns Hopkins, we support the Johns Hopkins study, which is currently in process. And so I know they're really trying to encourage all of the communities to attend local events. They are also have an online survey, and they are doing one-on-one interviews with key stakeholders in the county as well. We really are pushing for the new county council to have a feasibility study of the health department. We feel that's the critical next step. But we also need to engage the community, like yourselves, and policymakers. We would definitely, for this process to move forward, so if the Pennsylvania Department of Health, just like as a normal budgetary matter, you can't say, oh, I would suddenly want to open a health department and they have to allocate $3 million out of the budget to Delaware County. That takes time, and you'd have to be in the appropriations bill from the governor's office to the House and Senate. So figuring out all those administrative logistics as well as what would need to be happening, that would in itself require a temporary Board of Health to help that process go along. And then figuring out who are the key stakeholders, and this is something that you guys could be very helpful in. Who are the key stakeholders that should be involved in this process? And thinking of how we can build some momentum. So that's a very brief overview. And there was another slide, because as I said, it was updating, that I wanted to update you on. So the current incoming county council does have a public health committee formed. So I'm serving on that. And we are delving into all the processes that we would need to do to form a county health department. But one of the things that we're looking at are what are the major public health concerns in the county. Again, a feasibility study and then Johns Hopkins needs assessment should help to bring some of those things out. But what we have come up with, the initial list, is really we're very concerned about increasing rates of gonorrhea, chlamydia. A lot of the sexually transmitted diseases are increasing in the county, which those of us in public health know that's like the canary in the mine. It's like when you start to see those things going up, there's usually other things going on. Certainly the opioid epidemic. There's been concerns around some TB cases. We are also looking at some maternal child health issues and how maternal mortality rates, morbidity in the county, particularly in minority populations, and lead has also been coming up. And then, of course, the environmental health issues are a whole nother thing, particularly, not just, we're looking at the pipeline issues for sure, and then concerns about the cancer and asthma rates in the county. So very broad issues right there, and we certainly, it's at the beginning stages, and again, looking for information from the Radnor Board of Health and others who can contribute to making that a better informed conversation. And just to let you know, January 12th, there will be at 2 p.m. at Elwyn, we have assembled some experts to come and speak to public health stakeholders in the community. So we will have Dr. Walter Tassou, who is the former Montgomery County Health Commissioner, he was also the commissioner in Philadelphia and president of the American Public Health Association. Dr. Hellman, the medical examiner from Delaware County, will be there. We will have Jean Krasner from the Chester County County Health Department. I'm moderating, and I think we have one more person. So we have a good panel to try to answer some of these questions and explain what currently happens in county health departments, what it may look like in Delaware County, and then also, trying to look at some of the negatives as well, like what would be the negatives of having a county health department, if there is any, and how do we address those. So very brief overview of a very complex and long-standing issue in our county. If there's any questions.
I have a question. This was great. I actually was not aware of all these issues and how complicated this is. And thank you for your efforts in sort of spearheading this. What I'm curious as to the League of Women Voters, your interest in being involved in this effort, number one, and number two, the numbers, STDs, where are those numbers coming from that they're on the rise? I'm surprised.
I can give you this is from the Pennsylvania Department of Health, from the county.
And this
health.
is for our count, for Delaware County, they're on the rise?
From the county health profile that comes out from the Pennsylvania Department of Health.
Okay.
They have been on the rise for the last couple of years. But very high on, I forget the exact number, so I don't want to quote that right now, but I can send that to you. But for chlamydia and gonorrhea, they are extremely high compared to surrounding counties and the Pennsylvania average. And then also, when you're looking at, there's other rates, there's certain cancers that we're higher on, asthma, school absences related to asthma were higher. So that, yeah, I can send you all that. That's all listed in the county health profile.
Thank you very much.
Is-
Very, very interesting. Go
The
ahead.
January 12th meeting, is that open for the public to come to? The panel?
Yeah, so I think right now they were doing, that's up to the incoming county council. We have assembled, the league helped them assemble the panel and I believe that like the Radnor Board of Health would be welcome. I'm not sure that they're prepared to have like a whole
Okay.
countywide meeting, but I will make sure that they get that information to you as well.
Okay.
May I ask a few questions?
Sure.
Thank you for the presentation. First question is, I thought I heard you say on at least 2 occasions, this has, as a proposal, has been voted down previously.
It was officially 1968 was voted down in Delaware County, and that was a public referendum.
And then you said
was,
a one
it
vote?
lost by a very small vote. I'm sorry. And then I was referring to the most recent in Pennsylvania at large was the Northampton and Allentown area tried to do a joint two-county health department, and that did not go to public referendum. That was a vote with their county commissioners, and they had to have both sets of commissioners agree. And that did not have, it lost by 1 vote.
So I might think it'd be helpful to understand why in those 2 occasions it didn't pass in order, and I'm not asking the question for,
Sure.
but
So
to try
in
and
both,
figure out how to get it.
both instances, there was a large marketing campaign saying that it would significantly increase taxes. However, the information and the data disputed that, but the marketing campaign went.
That kind of ties into the second question I would have, which I don't know whether it would significantly or insignificantly increase taxes, but if you have don't have something that exists and then you bring it into existence and it has a budget, then it would have to be paid for. And I'd be interested in understanding from you the governance. Who would the board, head of the board, be accountable to with regard to both fiscal accountability and performance accountability? And then on the other side of that, how would a county board of health relate to township board of health that may or may not already be extant?
So what would happen with an Act 315 county health department is they would be the county health department, and there would not be individual boards of health. Sorry.
So the townships would do in their boards of health in deference to a county board of health?
Right, but what happened when Montgomery County formed it, I just want to caveat that, so that the formation of that, in Montgomery County, they offered counties that had active boards of health and felt that they could do it better than the county health department, the opportunity to do so. And I think by 2005, all of the municipalities had been assimilated, I guess, into the county health department, and there was nobody was doing it individually because it wasn't cost effective at the end of the day for them to continue that. And there was, as far as accountability, just like any other county, like DHS or any other county group, they would be, the commissioners would be in charge of the ultimate accountability and budgeting. And then, but you have to, as part of being an Act 315 health department, you have to adhere to all of those regulations that are in Act 315 and meet the standards that the State Department of Health sets. So they can change. So for example, the 77 reportable diseases that are currently reportable, like, so that can change based on the
Sure,
Department of Health.
and we don't have to get too granular there, but just I don't feel any need to cling to any form of power or control, but I can tell you that for us, everything we do has to do with Radnor.
Right.
And all the work here is on a voluntary basis. So if you folded this Board of Health into a county Board of Health, it feels to me like most of what we do, which is voluntary and without a budget, would end up getting lost. So you might have to think about that if you're trying to develop a constituency. And I wholeheartedly believe that Delaware County should have a robust Department of Health. But you may not have that constituency if you come to a group like this and tell, well, we're going to do you in, because I'm having difficulty seeing how what we do would be done by a county Board of Health.
So, yeah, and you're bringing up the really good point, and this is the hard thing to convey in a short period of time. And actually, the person who would be best, and we could bring him here, is Dr. Walter Tressou, because when he formed Montgomery County, this is the exact problem that he had, because he had some townships and municipalities that had really good boards of health and felt like they were doing a lot, and they didn't want to lose that. And what Dr. Walter Tressou said that they had to really help them see is that, the breadth and scope of what a county health department far surpasses what a small municipality is able to do, and that all of the expertise, and you guys are fortunate here in Radnor because you have such a wonderful board here, but I can tell you that in other parts of the county that is severely lacking. And so how do you balance the townships that have, people that truthfully are doctors and nurses and people to serve on that versus some of the townships like around in Lansdowne that may not have that breadth of scope of people willing to be able to volunteer, and so that's the differences. But we absolutely have, and then integrating all of those municipalities. A lot of the health officers actually end up working for the health department that are currently doing inspections and other things. And because in many of the townships, they share health officers, and they'll have just the one health officer because they can't afford it. So there's some of it's to scale and being able to figure all those out. But they're all really good questions. I can tell you just the cost-wise, the estimate is the $3 to $5 tax cost to the individual resident of a county with a county health department based on what the other budgets are. You can have a Cadillac of a health department, or you can have a nice economy model. It depends on your county's needs and what you want to set up. But there is basic things you'd have to do under Act 315. So, do you have a staff of 50, or do you have a staff in some of the other counties of over 100? And some of it is the public health needs there. So, again, I point to, we have the city of Chester and Upper Darby that have lots of health issues and certainly there's a limited access. We have one federally qualified health center in Delaware County, which is Chespen. That may or may not be enough for this county. So lots of issues. I could go on and on because there is so much. I kept telling Roberta I'm going to be writing a book on this at some point because there is so much information. So these kind of questions, if you want to submit them and we could try and get them answered, I'd be more than happy to provide that information. Yep.
Thank you very much. Very, very informative, and I appreciate you taking the time to come and present this.
Yep.
So next step. So I'm going to the January 13th focus group meeting.
January 12th.
Oh, 12th.
12th. Yep.
Okay. Thank you for clarifying
2 p.m. I think it's a Sunday at Elwyn.
Elwyn is a school?
Oh, sorry, yeah, I'm from the media area, so Elwyn is like central. So it's the, Elwyn is the campus that has the large, I forget the name of it. It's special needs children, but it's a special, yep, yeah.
Did anybody else have a chance to go online and do the survey? I know, Jane, you went to the focus group. Any comments? Or?
I attended the focus group for the Johns Hopkins study last week, and it was a focus group for healthcare professionals. There were about 20 people in attendance. physicians, nurses, nurse practitioner, healthcare managers. And basically, we were charged with the question of what do we think the issues are. And I wrote down some of them that I'd like to share with you because I think it's important that we understand what is the makeup of Delaware County. First of all, Delco is a community that incorporates the well-to-do main line to the low socioeconomic status communities like Chester and Upper Darby, creating an enormous disparity in healthcare needs. This translates into pockets of many underserved communities. There's a lack of shared data and coordination. A pediatrician who was practicing at Crozier noted trends in her practice, but she has no data from Delco to see whether these trends are occurring elsewhere. There's a lack of shared treatment options and best practices. Instead of systemic thinking on health issues, there exists only patchwork solutions. There's a lack of timely dissemination of public health information related to health crises and epidemics. Most information comes from the state level, which may or may not be applicable to Delco. The focus of Delco's community health tends to be limited to mosquito control, emergency response, and the opioid crisis. Unlike other counties, there's a limited access to vaccinations. Case in point, there were 2 community flu shot clinics this year. One was canceled due to the lack of vaccine, and I actually attended the other one, which was very well attended. Lead poisoning, as you mentioned, is a huge issue in Chester, but there's limited attention paid to this problem. Air quality is especially problematic in Chester. Unlike other counties, there's no formal centralized organization and structure in healthcare. There are no databases. Residents do not know what services are available to them and how to access these services. Availability of services are not communicated. There exists an unrepresented voices needing to be heard. Other counties offer far more health-related programs than Delco. There exists an anti-vaccination movement not only in Delaware County, but also across the country, and no one's talking about it and trying to solve this issue. Childhood obesity is an epidemic with little or no attention given to it. Violence-related prevention programs are realized on the state level as opposed to the county level. TB management exists only on the state level. New health-related legislation trickles down to the communities vicariously. And there is a need for health literacy in Delco, especially in the underserved communities. And obviously, this translates into a need of some centralized health care program or department that these issues and others that can be taken care of and addressed. Thank you.
It's an outstanding summary.
That's great.
Very
There was
good.
a lot.
Yeah. Well, thank you. So, well, thank you very much.
you.
We can definitely keep in touch. I'd be curious to hear the outcome of the January 10th meeting, so maybe we can talk offline and get some feedback and momentum. So what else we can do as the Board of Health?
I think supporting the Johns Hopkins study, absolutely. So getting that word out to the community. I think it's been posted in the libraries and things, but I think they've been really struggling to make sure that they're getting a wide breadth of people responding. So connections to some underserved communities, if anybody has those, is helpful. And in your own community as well. And also making sure that we keep up communications with you guys as this process goes through, because you're in the front line of this, and so how would this affect you is an important thing to hear. And what are your concerns? I think that's really important. And then how do we help if I spoke here, I can't believe this. I looked back at my notes in 2009, wow, talking about the health department. So I've been talking about this since 2007. And so some of you know, if you knew Dr. Plotkin, he was a pediatrician. Yeah. Yeah. So Dr. Plotkin is 95. And he has been helping me with this since I started in 2007. He was on the original committee in 1968. And so he said he'd like this before he dies. So, there's been a lot of people working on it a long time, so your support in helping this in any way would be really helpful. Many of you have a wide breadth of knowledge and understanding of different issues, and that's really helpful. And then, that's where we're at right now, is building up some momentum.
And is a John Hopkins study for the public to participate in?
Yes.
And how can the public get involved with
Yep.
answering the questions, I guess?
Yep, so there's an online survey. It should be on the county website. Is it on your website too? On the Radnor website as well? And the county, yep. And then there's also, you can sign up. I think there's still 2 more public events that they're having. That's also on the county website that you can register for, although I heard that those were filling up quickly. And then they also, we're still, if you have like an area of specialty, there, John Hopkins still wants to do one-on-one interviews or maybe pulling key stakeholders together. So just going on, and you can fill in those on that survey. I think there's a thing, if you're a stakeholder, they might call you individually. So the survey is the first part. But then also encouraging the county to do the feasibility study. And if you know of, we're also looking for possible nonprofit funders of a feasibility study, which would be helpful to the county since it's not in the budget this year. And yep.
Right. Do you think it'd be worth having, who was the gentleman you talked about?
Dr. Walter Tusu.
Yeah.
I mean,
Would that be worth having him here, or?
Yeah. I mean, if you can't make the January 12th one, or, yeah, I can talk. He's very open to talking.
So I'd be curious,
yeah.
like, obviously, the data alone, just to be able to share that and know what's going on in the county is invaluable.
Well, so Dr. Hillman actually would be also good to talk to, because he's very into he's concerned about the data and epidemiology in the county,
Right.
and he's the current medical examiner. Obviously he can't take a stance on the health department one way or another, but he is concerned about data and epidemiology.
I mean,
and
that
he could
alone,
fill
but
you
I
in
guess the
on-
other concern is money and, what this would entail, so.
Yep.
All right, great. Well,
Thank you.
thank you so much, Rosemary. Thank you. Thank you so much. Okay, so thank you for that. So Kathy Durr's been kind of changing the ship here a little bit. Kathy's been doing the meeting minutes for 2 years. I didn't know if anybody wanted to step up and take them over for a year. We can talk offline. If you're interested, let me know. So appreciate that. I'll put something out on email and we can talk offline. She does. But I did them for a couple years, so I understand. Okay, so anything else to add? So we can also talk offline about some future presentations. And do we have any public participation?
Sarah Pilling, Garrett Avenue in Rosemont, with reference to Ready for 100, which is the program to address climate change. It's absolutely vital and very frustrating that we have no base data on the incidence of asthma, COPD, and heart disease as temperatures are going to increase through climate change. And so I really think it's absolutely vital and actually quite unconscionable that Delaware County's never had a health department to go to. I'm just one person, but I really want to encourage Radnor to really encourage this and go out for it, because we in Radnor, we have no baseline, so we have no way to measure any kind of data and any kind of progression in order to address these issues of asthma, heart disease, and COPD, and health-related incidents with seniors, and temperature is really going to be vital. It's one of the things that's killing the elderly is the high temperatures in the summer, and it's only going to get worse and worse and worse. Thank you.
Thank you for those wonderful statistics. They were rather glowing in their negativity or their scariness, sort of, like what's really going on outside of Radnor Township. When I knew that this was being discussed, I mentioned to one of my physicians at the hospital about it, and he looked at me and he said, "Oh, we're fine in Radnor." I said, "We are, but there's 48 other municipalities in Delaware County that may or may not be." I just wanted to say I included Jamisha Franklin, who's the Director of Patient Experience at Bryn Mawr Hospital, with my initial email and with this website that I sent out. And I was curious as to the other mainline health facilities that are in Delaware County. I'm wondering if there is someone within those hospitals who might have their finger on the pulse of patients coming in who are underserved, who have not been able to get to the services they need, and therefore that's impacting their hospitalizations, the insurances, or the lack of their health care that they have. And that might be an interesting subset of information that they might be able to provide to us. I'm going to follow up with Jamisha, but at Bryn Mawr. But I'm wondering, like Riddle, and things like that, if there is such a person or a department at those places, we might also get some information from them.
Give you, Ms. Franklin could give you some
Right.
leads with that at
Right.
Riddle, and
Yeah, I'm going to check in with her
yeah,
after
definitely.
the holidays,
Yeah,
I
that'd be
think.
good.
But yeah,
Mhm.
and see what she might, she has her master's in public health, so she certainly, is right there. So again, it's really important to reach out of where we are so blessed here in this township for what you all are doing and what we're all capable of getting and receiving. So thank you so much.
Thank you, Kathy. Any other public participation? We have a great crowd here tonight. I'm really thrilled. All right, so I think we're just about finished. Anybody else have anything to add? So I just wanted to make a note. The next Board of Health meeting is Tuesday, January 21st, not Monday, due to the Martin Luther King holiday. The other thing that I wanted to mention, we're in the middle of flu season, so if you've not had your flu shot, there is still time to get your flu shot. Very, very important. We're seeing quite a bit at the hospital, so very important. And I think that wraps up our meeting. So we'll adjourn it.